in the facility was true. Honorable members will bear me witness that not once, not twice, but many times, their electorates have called them to report that they went to the hospital and they were told to go and buy gloves for the attendants. The management is confirming. What was the root cause? They said that they were under budgeted. They cited that as a root cause. It was also reported that the washing machine in the hospital needed replacement since it kept on breaking down. Madam Speaker, as to why it keeps on breaking down, we do not know. And the approximate cost of a new washing machine was put at 36 million. We did not see any requisition for the same. The hospital management admitted that the asbestos roofing in some hospital building was a health risk to the patients as well as the staff in the facility. Proposals on replacement of the roof had previously been made, but implementation stalled due to lack of budgetary provision. The mortuary was reported to be in a very deplorable state and posing a health hazard, and hence the dire need of building a new modern mortuary in the hospital. Madam Speaker, those are the responses that we received from the management, which in an extent confirm the observations that the committee made. These are our findings as a committee. From the above observations drawn from the site visit and discussion with the hospital management, the committee made the following findings. Cleaning services of toilets at the outpatient casualty department is not managed efficiently and effectively, and the attendants seem not to be well informed on the use of PPEs. If a training is necessary, Madam Speaker, we will recommend such. The supervisory of the cleaning programs at the outpatient department is not well coordinated and can expose the patients, the workers, and the workers to infections. The committee also noted that the cleaners the department is understaffed, not well capacitated to undertake cleaning services in such a facility. We also found out that the hospital has neither a queue management system nor a personnel at the customer care desk to direct patients, also to guide them where assistance is needed. Our findings also that the revenue collected in the facility is banked in the county revenue account, and the hospital had no access to the funds whatsoever, despite the existence of the Public Finance Management Act, that is Machakos County Health Service Regulations, that provide for plowing back of fees and charges collected in health facilities. The hospital is understaffed in all cadres. This is another finding we made. This has occasioned the long queues of patients, and some of them end up being unattended to at the outpatient department, especially those on appointments at the specialized clinics. It is also another finding that the hospital faces a very inconsistent supply. Madam Speaker, we insist very, because if something as small as gloves is not available, what about a bigger item which might cost much more money? It is inconsistently supplied. That is both pharmaceuticals and non-pharmaceuticals supplies, which poses a big challenge on service delivery to the residents of the county. It is also important for us to note that when the hospital doesn't provide these important tools of work, it acts as a demotivating factor for the workers. The casualty minor theater, minor center, and the hospital mortuary are in deplorable state, and there is dire need to have them renovated. We also found out that the management has no guidelines on the procedure of approvals of study leaves for medical personnel. Madam Speaker, having done all that, we have several recommendations that we are putting forward for the department to adopt and to implement. Based on the above findings, Madam Speaker, the committee makes the following recommendations. The hospital management should come up with a clear policy on cleaning services. This can be achieved through creation of infection prevention committees and ensuring that the cleaners are well informed on the precautions they need to take when dealing with the various waste in the hospital to avoid subsequent infections and health hazards. The management should competitively outsource all the cleaning services. We also recommend that the hospital management should endeavor to have an automated queue management system in the budget estimates for the financial year 2023-2024 to manage patients at the casualty and outpatient department. In the meantime, the personnel working in the hospital and the Department of Health at large can be deployed at the customer care desk to manage the queues. Madam Speaker, when you go to most of our hospitals, you realize there is nowadays a new department called hospitality. I do not know whether we need hospitality in a hospital. Perhaps those people who are being touted to serve in that department can assist in managing the queues. We also recommend that the department should do a staff audit of the medical personnel in Machakos Level 5 with a view of identifying the understaffed cadres and proposing recruitment to fill up the vacancies. We also recommend that the CECM, the Department of Health, in collaboration with the CECM, Finance and Economic Planning, should operationalize the Public Finance Management Act, that is Machakos County Health Services Regulations. This will ensure that revenue collected in health facilities is utilized in the same facilities on consumables and services that are urgent and promote service delivery. The hospital management should ensure that guidelines on leaves such that an officer can only be released when there is a reliever available. In the meantime, a urologist should be engaged on contract basis to stand in for the one who is on leave. We also recommend equipping of the minor theater, the trauma center at the casualty, and the trauma center at the casualty department, the renovation of the mortuary, and purchase of a laundry machine should be given priority in the budget estimates for the financial year 2023-2024. The department should streamline the supply of pharmaceuticals and non-pharmaceuticals in the hospital. This can be achieved by ensuring sufficient budget allocations are done based on annual consumption of the items. Timely requisition, payment to supplies. Madam Speaker, you realize the issue of pending bills is an elephant in our house. Proper stock management and coding of supplies for ease of traceability. You realize sometimes medicine and other supplies will come to the hospital and they disappear. As to how they disappear, perhaps nobody can tell. We also finally recommend that the department should implement the Machakos County Health Services Act 2020, which creates the hospital boards for level 5 and 4, health centers and dispensary committees. These hospital boards and facility committees oversee the management of the facilities. Madam Speaker, in conclusion, allow me to acknowledge the Department of Health and Emergency Services for the response given and proposals given for the management of Machakos Level 5 Hospital. I wish to appreciate the Health and Emergency Services Committee members for their dedication during site visits, committee sittings, and compiling of this report. Honorable Speaker, the committee expresses gratitude to the Office of the Speaker and that of the Clerk to the County Assembly for the continuous and relentless support received as it discharged its oversight mandate. It is therefore my duty on behalf of the Health and Emergency Services Committee to table this report and recommend it to this Honorable House for consideration and adoption. Thank you, Honorable Speaker.
Thank you, Honorable Member. That's a good report, members. I now propose the question that this Honorable House discusses and approves the Health and Emergency Services report on the status of Machakos Level 5 Hospital. May I now invite members to debate that report. It's your turn, honorable members. Honorable Matthew, then the Majority Leader.
Yes, thank you, Madam Speaker. My name is Matthew Ndunda Wilson, representing Kangondo North. As it has been stated by the Chair on Health, indeed we went to Machakos Level 5, and what we can confirm exactly, those are the issues as they have been articulated. And it is our concern, basing on the affairs of the county, whereby that is our biggest hospital, where all sub-counties, they report to Machakos. And when you go to that kind of an hospital and find those kind of challenges, it becomes a very critical affair. All starting from the issues of toilets, going all through to the issues of the services in terms of the medical offering. You find it is big challenge, and therefore we request for this adoption to be given a priority, and in fact the matters be taken serious. Because now let's talk about the cases of corona, which is now eating our county. You find if such kind of situations are not given the priority, then we become a challenge in this county, and therefore it puts our state in a bad condition. And therefore, it is our concern that if possible, all stakeholders to take the responsibility, especially based in that in the issues of a report was presented yesterday. You find health has a lot of resources in terms of cash being given, and therefore if they are being given money and they are not accounted, then it becomes a challenge. And therefore we request this motion to be given a chance and debated to the fullest. Thank you.
Thank you, Honorable Member. Honorable Ndawa.
Thank you, Madam Speaker. Initially, you had referred to me as the Majority Leader, and I can see that is a sign of I becoming a Majority Leader of this House.
Minority Leader.
And that so I appreciate. Honorable Speaker, I will start by applauding the committee and our most able chair, Honorable Vincent, for coming up with a very brief and very elaborate report touching our health facility, that is Machakos Level 5 Hospital. Honorable Speaker, the committee has eased, or it has reduced the work of who are supposed to manage the hospital, because the committee has come up with very good recommendations. If we can go by this recommendation, Honorable Speaker, I'm very sure, even if we are not going to to finish all the problems, we will reduce them by a very big margin. Honorable Speaker, there are some issues that I want to talk about. The committee observed about issues of asbestos in the Machakos level 5. And I want to report here, Honorable Speaker, whatever is happening in Machakos level 5 is also happening in some other, in other health facilities. If you go to Mala, you'll find the same. You go to Kangundu, you'll find the same. You go to Matu, you'll find the same. And this is a problem. This is a problem. When we say we'll remove all the asbestos, we did not talk of where to take them or how to dispose them. We tried in another facility. And the asbestos that were removed are just kept somewhere and covered with the canvas. We did not get a good way of disposing. So I would request the committee also to assist us in finding a way of disposing those asbestos. Honorable Speaker, the other issue which is not clear on the report, the chair has made it very clear that the cleaners are working without protective gears. And it is not clear whether these cleaners are employees of the county or are employees of a particular contractor. It is good to know, so that we can be able to know who to ask. Because if these are our employees, Honorable Speaker, now the aspect of law of tort comes in. And it touches on issues of negligence. Honorable Speaker, from the report we are getting, we have heard from the report or from the chair, an officer who is the only one in the facility is given a study leave, and whoever is giving him a study leave is not looking for somebody to relieve that officer. Honorable Speaker, if we allow this to happen within our county, it means that during that study, all the patients who come to that facility to get services will not be attended to, because there is no one to handle that docket. So, Honorable Speaker, that is where now I'm talking of issue of negligence. Negligence is either omission or commission. And whoever is doing that, he or she must either, within the shortest time possible, recall the person who is on study leave, or source for another particular person, even if it's going to get him or her from Kenyatta or another facility, to ensure that we have that service being given in our facility. The other issue that I've observed, Honorable Speaker, the report is very clear. It has not touched our medical staff. So it is only fair for us as an assembly to say echo to our medical staff, because they are giving us good services. We need to appreciate for the good service that we get. It's only that the only challenge is that they are working without what they are supposed to use. The committee is recommending that we ensure that orders are done in good time. We don't need to wait until when everything has been exhausted, then we start ordering. And you know the bureaucracy of procurement. So whoever is supposed to order for these drugs, who is supposed to order for gloves and other items, let him or her place the orders in good time, so that we don't find ourselves in that period of deficiency or cavity. Honorable Speaker, another issue that I've noted is I've noted somewhere. is the issue of the theater. The theater. And also the casualty wing. Is it casualty wing? There are two departments that are said to be in deplorable situation. Honorable Speaker, if we don't renovate these two rooms, that now is also exposing our patients to another danger. You may be coming to be treated as a small problem, but you can get a bigger one, or a serious problem than the one which brought you there. So, Honorable Speaker, I want to support the report and request. There is what we call Ambuja Declaration. I don't know whether members are aware of something we call Ambuja Declaration. Ambuja Declaration said that 30% of all the monies should go to health. 30%. That is the Ambuja Declaration. And it was agreed by all the states, including our country, Kenya. 30% of all the monies must go to health. Honorable Speaker, I've seen here, there is the issue of health regulation. And I seem to wonder whether the CCM Finance is aware of this health regulation. Because the health regulation says that all the monies collected within the facility should be used in the same facility. But when the CCM Finance came in, he transferred, he gave direction that all the money should go to the county kitty. And if we allow all the money to go to the county kitty.
Point of information, Madam Speaker.
Proceed. Yes.
Thank you, Madam Speaker. Madam Speaker, I want to believe that based even on the ceilings that were set yesterday, whatever the member is saying has been achieved, because I can see a recurrent budget of 4 billion in health, 4,062 million, and development of 740. That makes it 4.8 billion Kenya shillings. And if our total budget, county budget, is 12 billion, if you calculate, you find it's over 30% that is going to health. Thank you, Madam Speaker.
Thank you. Good
well informed, Honorable Speaker, and that is clear indication that we are adhering to the Ambuja Declaration. Echo to our county executive, echo to the county assembly for approving that we use the 4.5 billion on health. And that is the way we can take care of our lives. That is the way we can take care of our people's lives. Honorable Speaker, I was saying, if the money goes to the county kitty, there is a risk of the money going to build the road, going to drill water, or going to do other activities, while the hospitals are staffing. Honorable Speaker, you'll be surprised to go to a particular hospital. You are told, go and buy gloves. And if you go to buy, whatever you are going to buy, I don't want to mention the hospital, the person who is selling there, the gloves, is the watchman who is in the gate, who is the man in the gate. So, Honorable Speaker, I want to agree with the report. Let us adhere to this. And I want to inform the report, the committee. Because I know this report was, the site visits were done a little bit longer, they're about 2 months. There are some reshuffles that were made. And I want to say, the officer who was now transferred to Machakos level 5 as the main soup is an officer whom I have a lot of trust on him. He's an officer who has all what is required to offer services. The factor of flexibility, Honorable Speaker, is very key in human resource. That officer can handle administrative matters. That officer can go to outpatient department, see patients, and admit those who need to be admitted. The same officer can go to the ward and discharge those who are okay. And the same officer can go to the theater and conduct an operation. So I want to inform the House that we have the best officer now in Machakos level 5, and I'm very sure, God willing, we will have a positive change in this facility. Finally, Honorable Speaker, there is the issue of motivation. The issue of motivation. there is the issue of motivation. Sometimes back we were discussing about county publics and county public service board. Honorable Speaker, I want to report to this House that some of the officers, medical officers, were to be promoted. And because of incompetence of the county public service board which was there, those who are called for the interviews, they were all failed. And that is demotivating our officers. So I'm requesting that the committee also to recommend those who are due to be promoted, let them be invited for interview and get the promotion. Thank you, Honorable Speaker. I support the report.
Oh, thank you very much, Honorable Member. Members, before I invite Honorable Brian Kisila, I just want to emphasize on the matters we spoke about yesterday concerning for calling the appearance of the CEC in different departments to come and appear before us and answer some of these questions that we cannot be able to get. Especially, I could hear that we have some questions we need to be answered and we don't have somebody to answer them. Members, I think we need to take that particular issue we discussed yesterday very serious and proceed and make such, I think, a standing order or something like that.
Maybe a concern, Honorable Speaker.
Thank you.
The House, through your leadership, has powers to alter the standing orders to allow the CCM for any department to be appearing before this House. And I will request the procedure committee to move with speed and bring the recommendation of amending such standing orders so that we can have that in place. Remember, the National Assembly went the same route. County Assembly is a replica of National Assembly, so we have a leeway. Thank you, Honorable Speaker.
Thank you. I hope the procedure committee is represented here, has heard what members are saying. Honorable Kisila, do you wish to say something?
Madam Speaker, I must say that this House is raising the standards. And we can even see the Speaker contributing to very key motions and giving directions. This is the way we are going to continue. And if we continue like this, I can tell you, Her Excellency the Governor, together with ourselves, we are going to deliver the mandate. Oversight does not mean you see things going wrong and you keep quiet. The minute we keep quiet, we are actually letting the people who brought us here down. Madam Speaker, I also want to comment on the importance of chairmen and members of committees taking their responsibilities seriously. And on this matter, I wanted to commend my chair. I'm a member of this committee. We have a very able, tough chair in this committee. And you can even see the quality of the report which we are presenting here. Together with our very able clerks led by Madam Nora. Madam Speaker, before I contribute, I want to propose that we, moving forward through your panel, we start looking at rewarding and bringing awards to this assembly of a Chairman of the Year Award, Vice Chairman of the Year Award, Committee of the Year Award, Madam Speaker, Whip of the Year Award. Can you see, it's only Deputy Whip who is in attendance today. Majority Whip is not here. Minority Whip is not here. And their role is to whip us to come here. We need to start taking issues seriously. On this matter, I want to commend Banadi for seriously taking the work of this assembly. If we don't take work of this assembly seriously, I can tell you, we can give departments money. Again, hakuna kitu tafanyika, Madam Speaker. Whip of the Year, Leader of the Year, Leader of the Year, Contributor of the Year Award, right? And we need the Deputy Speaker and the Madam Speaker and the Deputy Speaker to be the ones in that panel, so that we can be able to come up with a very tough, detailed award scheme. And Staff of the Year, ndio tuanze, we start taking. Actually, let me tell you from yesterday, members, you saw from yesterday that the assembly has actually have gone a step up. We are not just doing business as usual. We are now raising the bar. The bar has been raised. Madam Speaker, my contribution is very brief. Revenue collection is a very key important aspect of this county. And Madam Speaker, one of the findings is of streamlining revenue at the hospital and ensuring that revenue comes back. There is an act to that effect which ensured that money is supposed to be plowed back to the hospitals. The second point, Madam Speaker, I have is on ensuring that we streamline supply of medicine. Madam Speaker, can I asked the CC Finance, how much medicine have we bought? To surprise you, Madam Speaker, to date, we have bought medicine worth 80 million. Over 80 million. But if you go to the health facilities, all of us honorable members who are here, you will not find the medicine. So where is the medicine? My chairman said in Monday meetings, the cartels are regrouping. And that is a fact. Madam Speaker, the cartels which were there are regrouping. And they are actually ensuring diversion of medicine. We are giving health department a lot of money. But we cannot continue giving them money if they cannot show us they have the capacity to put systems to control and ensure the medicine is going to the right person. So, Madam Speaker, as a committee, we are very concerned. And as you said, we have actually summoned the CC Health on Monday. We were supposed to start at 9, but we want to meet him for 2 hours, from 8 to 10 on Monday. I'm requesting members, please, 8 in the morning. Our committee is among the first, 8 to 10 at the plenary. Please come so that we can engage him. Let him take us through the plans he has, especially on medicine and especially on ensuring that our people are getting service. Then my last point, Madam Speaker, is on members, please, it is important that you read the Machakos County Health Service Act 2020. It is important. And by the way, members, we have a library. A lot of these acts were passed when you are not here by first and second assembly. Take time, go through this. One of the recommendations of this act is on creation of hospital boards. In the last term, second assembly, we were actually shocked that the CC Health that time went out of his way to bring very incompetent people to be board members deliberately, so that they can divert and actually siphon money from the hospitals. This act spells out very clearly who should sit in those boards, what is their mandate, and the controls they have. Members, we need to operationalize these boards on all levels, from level 5 to the dispensary. And we are the ones to approve those boards in this assembly. So members, go through that so that we move with speed. We are giving these people money. Let us ensure we oversight this money to serve our people. Madam Speaker, I support the report, and my final word is, let us ensure that we oversight this money properly. Thank you, Madam Speaker.
Thank you, Honorable Member. Honorable Ndi, Honorable Francis to follow, and Honorable Mary to follow, in that order.
Thank you.
Madam Speaker, I'm D. Kivuva, representing Wiper, marginalized, and a proud member of the 20 marginalized here in the Assembly. I'm also a member. I'm also.
Okay. And Speaker, do we have a group or a cadre in this assembly called
You may
marginalized?
be seated.
It's important that we start understanding. Do we have a caliber of members? When we enter here, we are all equal. But we have marginalized group.
And who is their representative?
Thank you, Madam Speaker. I acknowledge what Mheshimiwa Brian said, but his guess is good as mine. That we were, but we are not currently. But notwithstanding, I'm a member of the Youth Committee. And I want to support this motion by our chair. As member of Adriva, my good friend Mr. Kaloi, Honorable Kaloi, he talks of cartels. And it is good to support him because cartels are back at the Ministry of Health. They are even cropping, not cropping, but they have an ant. They have even come in the assembly. My speaker, Madam Speaker, when we went for the visit, which was early.
Do you mean cartels have come to the assembly?
I'm proving that point.
You'll
Yes.
clarify. Proceed.
When we went for the site visit at the hospital, to get a proper report from our staff on what transpired, we had to defer that report more than 6 times. Our clerks could not write what we found. And up to now, one aspect we found of our rogue staff has been missing, and the chair knows it. We found a staff who was very arrogant to this committee. In fact, the staff almost beat us. We had to remind the staff that we are from the assembly. That report is not part of this report, because somebody somewhere was talked to by the cartels and omitted. But
So, you're saying that
Point of information,
Madam Speaker, Madam Speaker,
I want
Madam Speaker, is it in order for a member to try to name a staff who cannot come before the House and defend himself or herself? Is it in order? Sure.
I think that particular information should have been included in the report for your information. Yeah, proceed.
I'm a member of this committee. On Monday, we sat down to deliberate on this report. Honorable D. Kivuva was not in attendance. It is important. Let us take this assembly seriously. When you are making those kind of comments, you should have come to the meeting and ensured that point was captured. Let us be fair. Because when you make such a comment, you make some of us look like we are cartels. And Mheshimiwa D, with all due respect, I would like you to withdraw that statement, because it means the chairman and members who attended that meeting on Monday are compromised. I want you to withdraw that statement.
thank you, Madam Speaker. I think I will not withdraw, because if we can go back to our reports and the answer of our committee, that has been a concern of our committee. But if you insist, I withdraw. I withdraw.
Thank you very much. Thank you very much. Thank you very much. Thank you. Because you are a very key member. Mheshimiwa Ndii, you
I
are a
have
very key
withdrawn.
member.
I have withdrawn.
You
Sit
are a
down.
very key member.
No, I have withdrawn. Sit down.
Thank you, thank you.
And you, please don't look me with those eyes.
Honorable members.
Then,
Honorable
Madam
members,
Speaker, let me go on. Currently,
Honorable members. Mheshimiwa
at
Ndii,
the hospital.
have a seat a bit. If a matter has been brought to the attention of the House that it is not substantiated, the law requires, or our standing orders requires, that it is withdrawn. I applaud you because you have taken that direction to withdraw. The other comment I want to make is that when a member is contributing and there is a point of information, point of order, point of what, and I identify one honorable member to bring on forward their point of order, the member who was contributing should sit down. Isn't that the procedure? So that we don't have two members standing at the same time. Thank you. Proceed, Honorable Ndii.
Thank you, Madam Speaker. Currently, the state of affairs at the hospital is dire. There is no medicine, there are no gloves, and the small things which should be at the hospital are not there. Currently, personally, I passed there, and I found women buying those small things at the chemist opposite the hospital. When Madam Governor took over, the first step she took was to equip the hospital. And people thought that would be the norm throughout our 5-year term. But currently, it is worse than when we left there early January. So I sympathize with my brother, the minority, when he has promised us that we have a new person who will bring new order. He has sunk the hospital down. I want to propose that although we will have the CEC on Monday, I want to propose here that we invite the CEC Health to a committee of the whole House, because some of the things can be tackled by the whole House. It is good that...
Point of information, Madam Speaker.
Okay. Proceed.
Thank you, Madam Speaker. I think unless it's amended on the report, that is not possible, or the House chooses to have its date for the same. But if the Committee on the Health has invited the CEC, then probably members can just come and listen to the proceedings, which I believe the Health Committee is doing well. We can come and listen to the submissions from the CEC. Thank you.
Thank you, Honorable Member. And that's why we should fasten our amendments so that we can be legally composed when we are doing this. Thank you. Proceed, Honorable Ndii.
Thank you, Mr. Diaz. I know where you stand. Thank you very much. It is good for the executive. It is good for the executive, Madam Speaker, to concentrate on service delivery and leave politics to us. Because now we are competing with the executive on matters of politics. Whereas our politics, this is the House to do politics. And it is good that they know that we are the politicians and they should concentrate on service delivery. And that if that one is done, I think the hospital will be fully equipped with medicine and everything else. If we had the CEO in our committee, Madam Speaker, and I can tell you, I want to talk about the cartels. If you look at the pending bills at the hospital, they are the same players with the same amounts. You'll find we have two departments in the Ministry of Health. A supplier in one department owes us 13 million, and in the other one 13 million. Uniform, 10 million, another one 10 million. Like 6 of them. So their cartels are fighting back. Madam Speaker, as a House, we must put our foot down and reject the emergence of these strong cartels. I stand to support the motion. Thank you very much.
Thank you very much. Honorable Francis Kitaka.
Thank you, Madam Speaker. I am Francis Kitaka, representing Nalani Ward. I want first to congratulate the Committee of Health for the good report that they have submitted to this House. We are talking of cartels, and we need to put this to an end. Importantly, this is the department that has the largest budget in our county. They have now at their disposal a ceiling of 4 billion. And if we are not careful enough, the absorption rates will be maximum on the other end of cartels when our people are suffering. I therefore recommend and request the committee and also the honorable members here that we must have a proper accountability of all the pharmaceutical and non-pharmaceutical items that are being purchased, and that has been purchased from the previous period of financial year 2022-2023. Why am I saying this? Because we'll have communication from the executive that we've bought medicine for 100 million, for example, but we cannot get the right and the proper documentation on how these medicine have been disbursed. However, with a budget of 4 billion ceiling, we need to know how much money is allocated for medicine in our county, so that we can be able to know whether it is enough or it is not enough for consumption. If we don't do this, then we'll be running the same gimmicks. Every time we have a purchase of medicine, it doesn't last even a month. So are we, in order, pumping so much money in this department, whereas our people are not getting even the basic medicines in the hospital? The other thing is, staff management in this department is pathetic, and it is in bad shape. I'll give an example of from my ward. We have a lab technician who goes on leave, and the lab is closed. Seriously, we need to address this matter critically. If we really want to serve our people, we must stand to defend and to ensure that the services that are required to our people are also rendered in the right manner. I would want to say about the management system of the patients. We need to borrow a leaf from even our private entities. The queuing systems are in place, and nobody will surpass the queue unless you are called. Let us have this implemented in our main hospital here, because it is where we experience influx of people. If we don't do that, then we'll have that system whereby a doctor comes in and a nurse, because he is a relative, you walk in 1 hour when other guys are other patients are on the queue, and then the one person is moved straight to see the doctor when the others are waiting. We do not want to have this kind of a situation in our medical facilities. Finally, we're talking of understaffing of our department. We know we are fighting a wage bill which is too high. I also want to reiterate a point that was also discussed in this House. It is until that we get the audited staff audit of our county, that is the time we'll think of how we are going to replenish the deficit that we have in our departments. Because we cannot keep on bringing people on board when we're still in darkness of how much staff do we have actively in our county. So I propose that, Honorable Speaker,
The report on staff audit be fast-tracked so that we can know the departments that are in dire need to be staffed. And on that basis, this assembly will have a recommendation on what to do next for our county. Thank you very much, Madam Speaker. I congratulate the team and their able chairman, and I think this is the way to go. Thank you.
Thank you. Honorable Mary.
Thank you, Madam Speaker, for catching my eye. My name is Mary, nominated to this house by the great UDA party. Now, in absentia of Honorable Maike, I'd like to nominate him as the fastest and the best opposer through you, Honorable Kisila, in our awards, in-house awards. Okay. Yes, in absentia.
For what award?
Our in-house awards
In-house
is proposed.
award.
Now,
Okay,
I have
proceed.
gone through this very good report by the health committee, and I think as a mother, I have not seen the inpatient department, the maternity wing. It has not been included. However, I would like to propose some recommendations to it. In the spirit of Lent, during the weekend, I happened to go visit a friend at the maternity wing, and I noticed that most of the patients there are bed sharing. You have a baby and you have to share a bed, which is not comfortable for them. I also noted that they need a bigger and a better equipped maternity facility wing. There are very, very many premature babies. I do not know why. And they need incubators. And they also have to share the incubators. It's actually congested in there. And there was one incident that didn't go right with me as a human. Now, you see, when anyone goes to the maternity, you don't expect to come back without your child, right? And it's unfortunate that we lose our children, but how our medics, they relate with the mothers that have lost their children didn't go right with me. They need special care. They need psychological help. They actually need, I think, a better wing to deal with that, because no one wants to lose a child. So my very able, committed chair, Honorable Vincent, kindly, I would recommend that the committee goes back and looks into that. Thank you, Honorable Speaker.
Thank you, Honorable Member. Honorable Paul, Honorable Kaloi, and Honorable Maeke, in that order.
Thank you, Madam Speaker. My name is Paul Wambua. I represent Kibaoni Ward. First of all, let me thank the committee and its chair for this good report. My starting point is to state that the wealth of the people of Machakos County will be measured by their health, because I say my health is my wealth. Machakos County Level 5 Hospital is the highest level medical facility in this county, and therefore it's a facility that we should give very keen attention to, a facility that as a county should make sure that performs very well for the good, the wellness of our people. And because every time in this nation when we speak about matters touching on public good, there are things that we call cartels that always hinder the service delivery, the good streamlined running of these facilities. And that's why I want to request the Health Committee through their able chair, our able chair, Mheshimiwa Vincent, as you talk to the CCM Health, let him know clearly that in this department we need a dictator-like leader. In countries which have seen better economic growth, like for instance when Gaddafi was in Libya, he streamlined their economy, their health, their housing, and other sectors before he was brought down by the black. So we need someone who will work to make this hospital, to kill these cartels without minding about their wellness, because they are working to kill our people. Madam Speaker, this facility should be a model facility for other facilities in this county. For instance, all the issues that I've seen touching on this facility touch on other lower level facilities. The issues of pharmaceuticals, the issues of staffing and relievers. For instance, the other day I was in a dispensary called Ndongo in Kibauni. The guy who attends to patients there was going on leave, but there was no one to relieve him. So what I'm saying is that what is ailing our level 5 cascades down to other lower level facilities. And that should be, we should make our level 5 a model so that all other facilities copy that model downwards. So Madam Speaker, I would also request the committee and this House that we pass, is it a motion or a legislation that sees Machakos County government helping people to pay for their NHF contributions. For instance, Madam Speaker, we can say that for a certain age group of our population, the county can put in 200 shillings while the patients put in 300 shillings. And that way, we'll also be encouraging our level 5 facility to be earning from, to be getting earnings from NHF. Madam Speaker, I support the recommendations of the committee, and I applaud them for their good work. Thank you, Madam Speaker.
Thank you, Honorable Member. Much has been said. Let us be very brief. I think we are exhausted this. Proceed, Kaloi.
Thank you, Madam Speaker. My name is Jeremiah Kaloi, representing the great people of Athriva Township Ward. As we deliberate on the issue of the committee, which has done a well commendable job, I have 1, 2, or 3 things that I've observed within their recommendation. One, I usually ask myself about these cartels. And Madam Speaker, in short, the word cartels is an association of people who are coming together with some specific interest and agenda that might not be good to the common wananchi. That is why sometimes we refer these groupings as cartels. I've tried to see what is in the report, but I don't know if it was an oversight, but I think the chair and the committee might go back also and try to see, because in these hospitals, you find in our labs, those labs, there are usually lack of reagents. So patients come there and they go to seek some services outside the main hospitals. If you try to follow up, the hospital has no reagents. That is one thing. I don't know if the committee find out that. The other thing is, we have a lot of moving ambulances within the county. I usually call them shell moving vehicles. These are vehicles which were purchased sometimes back, but they are not helping this county. A point in mind, last weekend I had a patient in my ward who happened to have was involved in an accident and was taken to the nearby hospital, and he was forced to come to Machakos. Unfortunately, the ambulance had no oxygen, so the patient succumbed. So what do I want to say? There need to be an overhaul of these vehicles, because the purpose of bringing or buying these vehicles was not to make them shells or to make them, I don't know.
Point of information, Madam Speaker.
Point of information, proceed.
Yes, thank you, Madam Speaker. Madam Speaker, it's good that the member is mentioning about disposing the odd vehicle. But it's yesterday when this Honorable House slashed out money meant for leasing other vehicles. So the question becomes, if we dispose now the existing ones, what will the departments be using? So as we talk of disposing, we also have to get other vehicles that will be at least acting as we dispose the others. Thank you, Madam Speaker.
Thank you. You are well advised.
Thank you.
Honorable
Yes.
Aloy.
My question is, can these vehicles also, which are existing, be, at least we have the necessary equipment on these existing vehicles, like oxygen and even first aid kit, because most of them, they don't even have the first aid kit, and they are located in this hospital. If the level 5 hospital has got no such vehicles, what about the level 2, the level 4, which are in our wards? It is so shameful, but the cartels has to end on the same. Lastly, let me thank the committee for a commendable job. Well done, Chair, and the committee. And we are going to work the same, and we are going to finish the cartels in this hospital. Thank you so much.
Thank you. Honorable Mike.
Thank you, Madam Speaker.
Honorable Katiti, winds it up. We move.
Thank you.
Majority, the real now majority. And DS. Thank you.
Thank you, Madam Speaker. And I believe, from what I've observed from the National Assembly, the priority of speaking is usually given the leadership, then others follow later, if I'm not wrong, when people are doing contribution. However, I want to stand and first thank the committee. I've seen the composition of the committee. It's composed of able members. And I believe the so-called cartels will have no place unless they influence the chair, who I believe is uninfluenceable. And I'll just go straight to the recommendations, because I will concur with Honorable D. As a resident of Machakos, we are the great users of level 5 hospital. Most of our patients, we are like the great users of this hospital. And we usually go there. And the chair can attest that after every 2 days, I'm calling him, trying to help a patient who probably is stuck. Personally, I've gone there to the emergency services, and what you have said is what I've personally gathered. One doctor in a whole night shift with 4 nurses, they cannot be able to attend the influx of the patients, and especially at the casualties. And in the recommendations, you'll find all the recommendations that the House is making are all geared and are all pegged to money. But you understand that, Madam Speaker, if our hospitals cannot generate enough money, this problem of having no theater, no supplies, no pharmaceuticals will never end. And it is the high time the Department of Health come up with solutions. And let's look at the issue for queues. Why are there many queues? There are many queues because somebody has traveled from Matu Yata, where he was supposed to be attended at a level 4 hospital, to come to seek the same services. he should have sought in Matu level 4. Why are there queues in the hospitals? Because there are not enough staff. And for your information, even though this is not, it's unverified, there is a lot of pastoralism. There is a lot of people are moving from level 5 hospitals to Canada, to UK. Yesterday, 2 doctors, friends of mine, wametoka hospitali hapa, and the committee should look into that. Probably, are we paying our...
Point of order, Madam Speaker.
Thank you.
I don't think it's in order for the honorable member to bring us unverified information in the House.
Restrict yourself, honorable member, to verified information.
Thank you. And I said unverified. I'll stick to the verified. And the verified says that the verified says that there is no enough supplies. How can we look into the issue of enough supplies? We are talking about cartels. But who are these cartels, Madam Speaker? Cartels is any group of persons, as Honorable Kaloi has put it, who have gathered together, and this will start if all of us have one desire to ensure that services are delivered. Even a good house like this, if it doesn't follow the laws, the regulations, can become a cartel to promote evil and to promote and proper service delivery. What am I saying? I'm saying let us look for procedures. I'm looking at let us have my recommendation and my proposal to the committee would be, let us have doctors have what you used to call satellite outreaches. There are a lot of doctors here. Let's say, for example, it's a doctor for ENT, and he has a satellite clinic on Wednesdays at level 3, Kimutwa. And we gather all the people at the ENT, they come there. You'll not find a lot of people coming because they come today, they are not served. Tomorrow they come. Let us have outreaches. There are a lot of doctors in the hospitals who are doing good work but not being maximized. My other thing I would say is this, Madam Speaker. Free medication is very expensive. It's very expensive. And even America and even all those developed countries, they don't have free medication. It is not free. And among, because they have come up with programs, like in America, they have their health care. In other countries, they have a lot of health care. Let us come up with a program which will enable the governor to deliver, because we've spent 80 million giving to dispensaries and it is not coming back. It's not.
Point of information, proceed, honorable member.
Madam Speaker, I'd like to inform the member that the last assembly passed a finance bill which actually put the rates for every hospital, including level 3, level 2, level 4, and level 5. But the Department of Medicine did not actualize that bill.
Can I inform the member, Madam Speaker?
You want to inform me on what? No.
That's a member. That's a member.
No, just hold on. Actually, I understand already that finance bill, the rates already have started being affected. I was in Mala level 4, and they have actually started using those rates which are from the previous finance bill.
Thank you.
Thank you.
Proceed, honorable member.
Point of information, Madam Speaker.
Oh, point of information.
Yes.
Do I need more information?
Proceed. Maybe it could be important, beneficial. Proceed.
Thank you, Madam Speaker. Sometimes when we are informing member, it doesn't mean that we are against what he or she is saying, and it is good also we all be in tandem on some of this information. Madam Speaker, in the second assembly was the finance chair, and on that issue of charges that were imposed on the finance bill were meant for people who are coming from outside the county. Madam Speaker, in the last 4 or 5 years, we've not been charging our patients who are coming from the county particularly, but out of that, we are getting so many patients now from Makueni, Kitui, and Kiambu to access the services from our county, and that's why we said then that for people coming outside this county should be paying, and that's when now we boosted those figures. I think if we introduce such, we can only talk to our people and pay this NHIF. Out of the proceeds from NHIF, we can be able to buy enough drugs for our people, other than introducing charges to our people in our local facilities. Thank you, Honorable Chair.
Thank you for that information, and I believe it's so important. Countries are run by policies. Honorable D spoke about politicizing, the executive doing the work of politics and us doing the work of, but we believe that everything should be done in order for the good help of our people. Madam Speaker, you're going to understand that if we are honest enough as members, the number of times we've been called for fundraising for sick patients are number without number. Yesterday, I had to pay 15,000 for somebody to go to the doctor's plaza for a sitting scan. Yet you find out that in the same hospital, the level 5 hospital, some of those basic amenities are not found there. Even if we don't charge these members, and I agree with Honorable DS, but Honorable DS, you're going to agree that there was a government program that was going on, I think in several counties, that was subsidizing. The county government, they were getting money, and that is why the previous government was, the government of Honorable Mutua was able to give free medication. At the moment, we don't have that subsidy. So it means that the money, even if we give them 8 billion, it will not be enough for this, because there is no plowing back of the same money. Health is one docket that takes a lot of money, and it is, you're going to find out a lot of people, a lot of our members are going to private hospitals. If they are able to go and pay millions in Nairobi hospital, why can't they pay a quarter of that in our hospitals? It's a matter of looking it at a positive way, and I agree with Honorable Member Wambua that we can encourage, and this Honorable House can pass a bill, and we say a certain hedge of people, we are going to subsidize them for they pay NHIF, and through that, and I believe the governor has spoken about that. So it's a matter of fast tracking that so that we can be able to get. Otherwise, I thank the committee for their good findings, and my prayer is the implementation runs a bit very quickly, and I agree with you, Madam Speaker. We need to amend, and we need to get answers from the right people, because we've had CEOs come, and the CEOs tell us it is the CC, and the CC will tell you it is the CEO, and then we are left not in a good place. Thank you, and I congratulate the Committee Health for putting that into place. Thank you.
Members, I wish to make a comment on the issue of raised by Honorable Mike concerning free medical services, 100% free. There are challenges associated with anything that is 100% free. I may not know to what extent these services are free. I have not looked at the law, the act. But honorable members, the reason as to why we are perennially not having drugs in hospitals, it's not because drugs are not there. Drugs could be there, but somebody, cartel or other people, make it so difficult for these drugs to reach the patients, so that they can divert them and take them to either to the private hospitals around to benefit from to make money out of that scenario. You find that there are no drugs by design in the hospital to make you move to the hospital, private hospital, to get services from there, and somebody benefits. So when we make these services 100% free, there is a catch. I'm also meant to understand that we have made water 100% free. It is not, because we have boreholes that need to be serviced. So members, let's rethink some of these laws we have made previously. Let's rethink these policies we have made previously and see how we can make services cheaper by making them expensive. or expensive by making them cheaper. Yeah, Honorable possible father of the house.
Yeah. And advice to this house.
Thank you.
Madam Speaker, it is not that I'm not supporting the report of the Health Committee. I'm supporting, but since members have spoken and spoken, I don't want to repeat myself on that. Madam Speaker, I want to congratulate you on your wise advice to this house. It is true, when things are free, the beneficiaries of those services, they themselves try to abuse these services. Madam Speaker, I want to give an example of an NGO known as Plan Kenya, Plan International. When they came to Masinga some years back, they could not do any project without the input of the local community. One day I asked them, why are you telling us to mobilize the community so that they can bring, not building stones, but maram and the local available sand? They told me, if we give this to you, this project free of charge, there is no way you will own it up, because you have not contributed anything. So, Madam Speaker, I'm agreeing with your wise advice. Thank you, Madam Speaker.
Thank you, member. Majority, very quickly, seconds. DS, very quickly. Sorry, Honorable Katiti, seconds. How many seconds?
Around 20.
20 seconds.
Yes, Madam Speaker.
Proceed.
Thank you for catching my eye. What I want to say, I want to thank the Committee of Health and the management of Machakos General Hospital, because of the recommendations and the recommendation that has come with the committee. I want to applaud them for what they have done. Mine is just about the recommendation number 9. We can see one attendant, male attendant, assigned to 12 toilets. And I believe it's in a major main hospital where it doesn't require just 1 hour or 2 hours or 3 hours to clean, to clean those toilets, but every minute, every time. So this kind of understaffing should be looked at, because it is trickling down even to our dispensaries down there. Because I can quote an example, like on my ward, there is Kaliambeo dispensary, where we have only one clinical officer. There's no cleaner, there's no supporting staff. He's the one who's cleaning the hospital, he's the one who's doing everything, the treating and all the way to cleaning. So we must take care of our staff and make sure that our facilities are well equipped with the right staff and the right staff. The other thing is about this issue of cartels. Everybody is talking about the cartels. We fear the cartels. I'll give you an example. There is one day, the rats were being killed by the cat, and they had one resolution. For them not to be killed every day,
they had to tie a bell at the neck of the cat, but no one who had to attempt that. They veered that cat because every rat that tried, it was killed. So the issue of cartels, it means if they are not in this assembly, they are in the executive, or they are anywhere else in Machakos County. So about the cartels, it means if the committee of health is not firm enough and the chairman will not be compromised, then it means you must be firm. Let you not fear, stand firm, be stout, and be courageous, because those people are coming, and it means the gods are back to us. So about the cartels, let the committee and the assembly take charge, because the MC of Kibona said, a healthy nation is a wealthy nation. So for us, if we will not be having the drugs in our hospitals, then our nation will be sick and the country will be sick. So I support your recommendations, and I want to invite you, the committee of health, to my ward, because even no single dispensary in my ward that has water. We need water in our dispensaries. We need electricity in our dispensaries. So I support your recommendation. Thank you.
Thank you, Honorable Kachiti. The real majority leader.
Thank you. Thank you.
A few seconds.
Thank you for really bestowing that title over and over again, because my brother, minority leader, seems to be very concerned with it. Thank you, Madam Speaker. By and large, what I wanted to say has been said by members, but I speak as MCA where the facility is situated, and agree with Mheshimiwa Maeke and Mheshimiwa Ndi that every other time we are called to the hospital, we've become, I would say I've become a nuisance, because if I go to the hospital, the in charge or the nurses and the doctors would say, MCA amekuja. And then they would, they would try to improve the way they are serving our people. What I would want to say is that Machakos Level 5 Hospital, our vision, and I hear this being said by the executive, by the minister, by Her Excellency the Governor, that we want to make it a teaching and referral hospital. And it comes with a lot of benefits for it to be a referral and teaching hospital. We'll access a lot of funds from the national government. We already have a university here. Okay. When it is a referral and teaching hospital and with a university here, it means we have a lot of students who are coming in as internship, and they could assist in some of these things. But for us to make it a referral and teaching hospital, we need to improve basic infrastructure. If I look at the report, the things that are coming out are very basic, like cleanliness of toilets, cleanliness of the hospital. How are we going to make it a referral and teaching hospital if we cannot get it right at the basic infrastructure? Number two, there is poor staff morale in the hospital.
Majority leader, you need to wind up. We are running out of time.
Okay. I think by and large what has come out is that we need to improve the morale of the staff in the hospital, because they are our friends, they are our brothers, they are our sister, and when they come, when we're interacting outside the hospital or their work environment, you can feel their frustration. So I think something has to be done in improving the morale of the staff at the hospital. Thank you, Madam Speaker.
Thank you, Honorable Member. DS, seconds, time is not with us.
Thank you, Madam Speaker. I'll start by congratulating the committee for the work done. Madam Speaker, I can now walk around and tell what is happening in that facility, and I believe that should be the spirit to all the committees, if we could be getting such information. Madam Speaker, I will only highlight one area, because members have talked much about the cartels coming back. And that issue of cartels coming back can only be dealt with if all the money is collected, is swept to a CRF account, then plowed back to the facilities. That way, they will never be able to get a coin in the facility. Otherwise, if we, whatever they want to, according to me, the information that has been given by the committee, their request mostly would be they want to spend the money at source, which is not allowed by the PFM Act. Let the money be swept in the CRF account, and so that for accountability. I've been the chair of finance, and we've never had a statement, any financial statement from health sector. And by that time, they used that money as used to be spent at the facility. So my submission would be let monies all go to the CRF account and be plowed back to these facilities. So because of constraints of time, let me stop there, Madam Speaker. Thank you.
Thank you, Honorable Member. Mover, will you take seconds? Thank you. Proceed.
Thank you, Madam Speaker. I will respond briefly because members have really articulated the issues. And I will begin with the latest reaction, that the initiative of the committee is not to have the facilities spend their income at source. The initiative of the committee is that let the money that is earned by the facility be spent improving the facility. Madam Speaker, the Honorable Minority Leader told us about the reshuffle and the new Medisup. What I think will happen is that this report will become the eye-opener to the new Medisup. Madam Speaker, in order to have to finish the misappropriation of supplies, the CCM proposed that he will ensure that there is proper coding for our supplies so that we can trace them once and when they are misappropriated. We will emphasize this as a committee. We will demand the CEC deliver on this one. The Honorable Undi observed about an arrogant staff. But the question is, if someone comes to the hospital and complains about headache, and maybe the doctor observes that this patient had acid which resorted to headache. Now the doctor will not treat the headache, he will treat the acid. What we observed, we were keen to see that this staff was not arrogant, this staff was frustrated.
Motivated.
Madam Speaker, the Honorable Mary observed that we have an issue at the inpatient department. Realize that this report only handles two departments, the inpatient and the casualty department. Why? Because this is the entry point of the hospital. We cannot go to clean the bedroom before we clean the gate, before we clean the sitting room, before we clean the entry point. Therefore, the other departments will follow when we address the outpatient and the casualty department. Because the casualty department is part of a referral system. All the cases that are being referred from the lower levels of hospital of healthcare centers are being referred through the casualty department. So we have to fix the casualty department as an entry point to the level 5 hospital. Madam Speaker, I want to thank the honorable members for contributing effectively to this report. I did not know that it will generate a lot of interest to honorable members. We will work together. We will ensure that we deliver on our mandate. We will ensure that we keep the department on its toes. And therefore, I will urge the honorable members, when King David was about to die, he told his son Solomon that I am about to go in the way of all men, but show yourself a man. I want to invite this house to prove to the other departments that they are oversighting, that they are up to the task. On Monday, we are having a special occasion where we are going to interact with the department. I invite members to join us from Monday at 8, and let us continue to discharge our work. I thank you, Madam Speaker.
Thank you, Honorable Member. I now put the question that this Honorable House discusses and approves the Health and Emergency Services report on the status of Machakos Level 5 Hospital. As many are of the opinion, say ayes. As many are of the contrary opinion, say nay. The ayes have it. The House is adjourned to today, Wednesday, at 2:30 p.m.